Good morning, everyone. Good morning. My name is Chinenye Kyobi. I'm a youth data advocate in FCT on the Data Made Simple project, and I'd like to welcome everyone to today's program. This is the National Dissemination and Launch of the DMS, which is the Data Made Simple project Storybooks at the national level. And we'd like to say a big welcome to everyone present today. And you can please introduce yourself on the chat box, your name, your role, your organization, and the state that you're joining us from. Please introduce yourself. Today is a celebratory program, so we would like to see the excitement by you using emojis and all of that to show that you're here. We encourage that everyone is an active participant of today's meeting. We welcome you once, twice, and a million times. Thank you very much for joining us. I'd like to share the meeting agenda so that everyone is affiliated with our program today. So I'll share the screen now and go through the agenda for today's meeting. Okay. So firstly, we're going to be having the meeting objectives and goals. We'll also have welcome address and goodwill messages from our partners and people that have supported this project, even from the government as well. Also, we'll be having the Data Made Simple project overview. Then success stories about this project would also be shared in video form. And then the launch proper of every storybook across the 7 states. And then we would also take reactions and comments. And if you also have questions, we'll be taking that towards the end of today's meeting, and then group photographs. Thank you once again. We would also like to set few meeting rules because it's an online meeting. Please, if you're not speaking, we would like that you mute your microphones. And if you've got questions, please make use of the chat box. Questions will be taken much later. And as I mentioned earlier, please let's engage ourselves. If you find someone that you've worked with and that you know on the chat box, please say hello to them. Thank you very much. Now, as we go on in today's meeting, we would like to take the welcome address. Before the welcome address, I'd like to read out the meeting objectives. First, today's meeting, we have the meeting objective and the purpose of today's meeting is to disseminate and launch storybooks at the national level and share project outcomes with stakeholders and partners. And everyone here present, we have the YDAs, that's the Youth Data Advocates. We have adolescent health desk officers in all the states that we have worked with. We have the members of the team of SWAG initiative, that Stand With a Girl Child initiative. We have our other stakeholders in the government and partners, and also the people that are implementing partners in SWAG. Thank you once again. We would like to ask that the Executive Director of SWAG, Margaret, take our welcome address. Margaret, over to you. So if you're just joining us, my name is Chinenye Ikeobi. I'm a YDA Youth Data Advocate in FCT with the Data Made Simple project. Thank you again. Over to you, Margaret.
Thank you so much, Chinenye, and good morning, everyone. That's if you're in Nigeria. Okay, so good afternoon, good evening, and from wherever part of the globe that you are joining from. Chinenye, I hope you can hear me, and I believe everyone can hear me as well.
Loud and clear, Margaret.
Great. So thank you, everyone. We're truly grateful to have you join the national dissemination of the Data Made Simple project, as well as the official launch of the Storybooks. And we'll begin by saying thank you so much. So for us at Stand With a Girl initiative, our vision is to ensure that every girl, no matter where she's born or found, is empowered to achieve her full potential. And as a youth-led organization, we expect that at every level of program cycle, that young people are meaningfully engaged. So one of the key objectives of the Data Made Simple project is to promote meaningful youth participation or meaningful youth engagement in data for decision making. And we're glad that even shown by today, you would see it's one of our youth data advocates that is moderating the session. Another key area for us as one of our thematic areas aside education and empowerment of women and girls is sexual and reproductive health and rights. So the Data Made Simple project has also found its way to simplifying data that would be used for decision, which will in turn promote and increase sexual and reproductive health information and services in Nigeria. It's also our own support as Stand With a Girl initiative to ensure that the policy documents, precisely the national policy on adolescent health and development is being domesticated and implemented in states by supporting states to simplify the available data. As much as we know there is paucity of data, we ensure that the available ones are disseminated, are simplified rather, into storybooks, into catchy picture. I won't say too much because the program coordinator will take us through all of the process, but it's just to say welcome and thank you for all of the support that we've received right from the national level, government partners to development partners to our amiable adolescent desk officers, the RH coordinators, family planning coordinators, the executive secretary, and in some cases, executive director, and of course, even the commissioners of the states, the 7 states that we've worked in. We just want to say thank you and welcome on board. I would say relax, see ways you can also partner this, because this is one of our key sustainability plan to ensure that this data is disseminated across the country, but importantly, because data are real-time data, are also continuously simplified, because yes, we've simplified some data that we found, particularly from NDHS 2018, that's the National Demographic Health Survey, Nigerian Demographic Health Survey, demographic health survey data that was simplified. We also look forward to continuous simplification of data that can be used for decision making, but at the same time, for education and sensitization of the public so we can dispel myths and misconceptions surrounding sexual and reproductive health. Just to say thank you again to everyone that has taken out time to join. And for those who will still join us, to say thank you, thank you. Sit tight as I hand you over to capable hands to take over, and shout out to all our YDAs. You guys have really worked tirelessly, and you know, you're one key reminder that Nigerian young people are not just the problem, they are not even the problem, but they are partners in progress, and they are the present and not just the future. Thank you so much. And I hand it over to our beautiful MC for today, Chinenye. Over to you. Thank you.
Thank you so much, Margaret, for that wonderful welcome address. Everyone on the chat box, we see you. Keep the introduction going. Keep the emojis going. We would like to welcome everyone. I'm seeing a lot of YDAs. It's so good to have you all here. Especially, I'd like to welcome Dr. Iwat Indayo. He's the chairman and director of Regima Community Care Foundation here in Abuja, Nigeria, and also an MSME officer of the FCT Primary Healthcare Board, Mr. Shuaibu Wakili. Welcome, and we would like to hear from you, and hopefully would hope that you would like to give us a goodwill message, just very short. We'd like to hear your voice. Over to you, Dr. Iwat. Wakili, we'd like to hear from you as well. Wakili, are you there? Or Dr. Iwat? We'd just like to hear from people that are not in the SWAG team and just get goodwill messages from you as well. But I don't know if you're saying anything because I can't see that. But welcome all the same. I think we'll move on, and maybe when you can respond, we'll come back to you. Thank you so much. There's a link on the chat box. It's an attendance sheet. We would like that you click on that link and fill your details very correctly. Thank you very much. We'll be moving to the project overview. I know that there's some of us here that have worked on this Data Made Simple project, but also there are people that maybe are new to this project and would like to give an overview of the project from the beginning to this launch time. And I'll be handing over to Ethel, who is one of our project coordinators for the Data Made Simple project. Ethel, over to you.
Okay, good morning, everyone. I don't know if you're excited about today. I'm so excited. I wish the camera can show my face. Okay, showing. Yeah. So today we'll be talking about our journey so far, our successes, our outcome, and also the project overview and processes. So wherever you are, sit, relax. If you have a bottle of water, if you have juice, if you have a cup of tea, so you can sip that while you listen to our processes. Thank you. So Victory, my beautiful colleague, she's also the program officer for the Data Made Simple project. So she'll be taking us through the project overview and also the processes. Over to you, Victory.
Thank you so much, Ethel. Good morning, everyone. It's so nice to have you all here. For want of time, I'll just go straight over to the Data Made Simple project overview. So SWAG initiative implemented the Data Made Simple project in 7 states: FCT, Nasarawa, Oyo, Akwa Ibom, Kaduna, Anambra, and Bauchi states, with fundings from Grand Challenges Canada, GCC. Also, the overall goal of the project is to ensure that adolescents and young people have increased quality access to information on AYSRH, as well as increased access to quality information on AYSRH and AYSRH services. With collaborations from community stakeholders, the primary healthcare board agencies, and Ministry of Health of the implementing states, we were able to liaise with 7 state adolescent health desk officers in selecting 35 youth data advocates in the 7 implementing states. And we were able to select youth data advocates ranging from ages 18 to 35, and they were selected from state technical working groups on adolescent health and development and other youth networks based on their creativity, their experience, their interest in data knowledge and understanding of AYSRH issues. So going over to the project preparation and design, 21 stakeholders were invited to the kickoff meeting, and this was to ensure that we build strong relationship and collaboration towards the project. We had stakeholders from USAID government representatives, youth-led organizations, young people and family planning / AYSRH partners who were represented. Also, we had data experts and the project team come together to collect data. After collecting this data, we're able to review the existing AYSRH data from the National Health Management Information System and the National Demographic Health Survey of 2018. And furthermore, we're able to ensure that the state and manual officers of these 7 implementing states validate these data to ensure that they're able to, own the data, and as we go further to using it in these 7 implementing states. So as part of the preparation and design for this particular project, 14 project team members' capacity were built on knowledge management, data visualization, creative storytelling, and translating the documented AYSRH and family planning data into storybooks to support the development of the storybooks model in the 7 states. We're also excited, and I know that you are also aware, for all of you who were part of the capacity building training, that for each of the states, 7 youth data advocates were 7 youth data advocates, making it a total of 35 for the 7 states, 7 adolescent health desk officers, 42 monitoring and evaluation officers, 7 family planning coordinators or reproductive health coordinators, and 2 representatives from youth-led organizations from each of the 7 states had their capacity strengthened to interpret existing AYSRH data and develop creative AYSRH stories. Also, going further, we had our AYSRH stories, we had our developed AYSRH storybooks that were developed during the capacity building, reviewed by storybook experts. So we had the storybook expert reviewer, we had the editor, we had it put into graphics formats by our graphics designer, and then we had the infograph that's using the data. We had to put it into infographics format, and also we had our books translated in 3 indigenous languages: Igbo, Hausa, and Yoruba. After the production of the storybooks, we had our youth data advocates, we had our M&E officers, and AHDU disseminate the storybooks. And this was to ensure that adolescents and youth had increased quality access to AYSRH information, thereby advocating for better health outcomes for adolescents, for youth, for community members, family planning service providers, and also we made use of the call to action in our storybook to target decision makers, which will lead to positive change in AYSRH services. So this is just an overview of the project preparation and design. I'll hand over to Etel, my project coordinator, to take over from here. Thank you.
Thank you, Vitri, for taking us through the processes of the project. So quickly, I'll be running through our results and outcome, and I still want you to sit down, relax while we go through the process. So to add one thing to what Vitri said, the goal of the project was to ensure increased quality access to. Can you hear me? If you can hear me, please say hi. Can you all hear me? Okay. So the goal of the project was to ensure increased quality access of sexual reproductive health information and services among young people in Nigeria. So how did we achieve that? Our focus was on simplifying AYSRH data in form of storybooks. You can see I'm holding a storybook here. that has a rich content. So it has stories about adolescents and youth sexual reproductive health, then also simplified data backing up those issues. Then we also have key messages, because we had two target audiences we're looking at. So that of the adolescents and youth being sensitized on adolescent health, and also our decision makers taking drastic change when it comes to the issues of adolescents. So to be able to achieve that, simplifying data was key for us, because if you can simplify data, it will also communicate well to the target audience. So we're able to come up with this data and also use pictures, catchy. So if you go through the story content, you see that it's more of pictures, less of words, and also being able to communicate to each audience. And it was also translated into different indigenous languages to cover a larger group. So now I'll move to results. Okay, one of our results, we developed and produced 7,000 storybooks to be able to reach out to adolescents and youths in the state. So while I was going through this results, I had to reflect back, looking at 2021, when we implemented the project first in 5 states. Do you know that it was 1,000 storybooks that were produced? So you can see that there was a huge progress, because we're able to reach out to larger audience, different communities were reached in the process. So 7,000 is way lot. Well done to our state actors and also SWAT team. So 105 states actors capacity were built on data programming. So we held a 3 days capacity building. And looking at last year, I'll always reflect back to last year so that we can all see our progress so far. We strengthened the capacity of 60 stakeholders. And this year, we moved it to 105. That is also a good result for us. Then looking at data, without data, how are we going to tell stories? So data was more evident for us. So looking at the issues, I will talk about when we were coming up with issues on the different states when it comes to adolescent and youth health. We had so much issues that tells on the needs. Please, can you mute your... Can I just check laptop? So that you know the meaning about. Yes. Sorry, let me mute the person's. Okay, I think we can. Okay, so as I was saying, when it comes to simplifying data, we had a lot of issues that tells on the needs of adolescents and youth. And I can remember when I was working with my colleagues, we brought out so many issues. But you know that when it was time to work with the data experts, they were not able to also bring out all data that reflects on those issues. So you see that there's a need for us to do more when it comes to disaggregating data on adolescents and youth health. But one beautiful thing is that SWAG initiative was able to still speak out on the existing data that speaks on adolescent health. And that we're able to work with data experts to come up and collect data that speaks on adolescent health. And that was where our foundation was when it comes to development of the storybooks. Then looking at these storybooks that were being produced, over 4,000 community members were reached in the different states. I know that some people might be asking how were we able to achieve that? During our 3 days capacity building training, the state actors were able to sit down and come up with work plan on how to reach the community. And from Abuja and other states, 6 communities were picked. And let me tell you that in as much as we didn't go to all the communities, there's one thing about ripple effect. If you reach out to one adolescent, that adolescent can also reach out to 10 adolescents. So we know that the holding outreaches and sensitizing community members, we know that their information have been improved to also talk to other adolescents and youth when it comes to their sexual reproductive health and rights. So now we also, okay, sorry, let me. So over 2,000 community members had improved knowledge on AYSRH. And how were we able to achieve that? So before the community sensitization, we also engaged the community by giving them a pre and post test. So some of them were not aware of the adolescents and youth issues. And some of them also had misconceptions when it comes to their sexual reproductive health and rights. And after the training and sensitization, we also sent the same questions to them. And mind you, we translated those questions into indigenous languages for easy communication. And we saw that there was a difference, huge difference when it comes to their knowledge. So also, again, there were more than 20 decision makers that were reached through advocacy visits. And they also made commitments to promote AYSRH as a result of the project. One of the commitments was from the executive chairman of the Bauchi State Primary Health Care Agency. He ensured that there will be integration of functional youth-friendly services into selected health facilities in all 20 local governments by December 2023. He also fostered youth participation in data reporting for planning on sexual reproductive health activities across 20 local government areas. So other decision makers also made commitments, which will be followed up after the project. So now I'll move to successes. Is there a project without a success? No. So we're here to tell you about our success. So one success for us was when we were talking about the project, we had a picture on how we wanted our storybook to be. Youth-friendly, catchy, to be able to also communicate with our target audience, to have more of graphic content and also words, data simplified in it, action points for our decision makers, key messages for our community members. And we're able to achieve that. If you go through it, for those that have not gone through these storybooks, you are missing, no, you are missing. There is a lot to learn. So after this our link for you to also view the storybooks via soft copies. So please give it to your friends, give it to people around. So we're able to produce something that was catchy, friendly, and responsive to educate community members, family service provider. Secondly, after building the capacity of our YDAs, the Youth Data Advocate, this project, and that's why we have Chineye in here. There's one thing, putting youth in programs. It will help for better communication, because when it comes to sensitizing adolescents and youth, if adolescents and youth get to see that whoever is sensitizing them is a fellow adolescent or youth, they sit down to listen and learn, because they see that they have people represented in that space. So the Youth Data Advocate transited from not just being participants to influencing decisions in programming. So we have our youth making exploits everywhere they go to. So in technical working group, when it comes to simplifying data, they talk about the project and see better ways that data on adolescent and youth sexual and reproductive health can be simplified enough. Also for workshops, drafting of policies when it comes to adolescent health, the youth are representing. If you're a YDA on our Zoom chat box, please can you give an emoji, an exciting emoji of your presence? Not too much. So let's move. So we also increased visibility of the simplified data storybooks in technical working groups. Also, a colleague of mine presented the Data Made Simple project in international conference on family planning, and she did so well. As in, we've gone global. We've gone global. And the National Nigeria Family Planning Service conference. Yesterday, I spoke on expanding access, family planning access, and programming for adolescents and young people. And I also used the Data Made Simple project as an innovative way to increase access and programming. So you can see that our visibility on simplifying data is increasing. And also, With support from our partners, they were also able to render technical support and work together with the youth data advocates during the community sensitization. I'll give an instance. Mariscope in Akwa Ibom provided some commodities to aid the dissemination process, thanks to Mariscope. And also in Akwa Ibom, do you know that the storybooks now are used to increase access to information in the adolescent and youth-friendly centers? So they use it, once our adolescents go there, they read these storybooks, and also their knowledge and information, knowledge is improved when it comes to sexual reproductive health. Then do you know that our adolescent, one beautiful success story was we able to reach students in school. So our adolescents, our girls, our boys in schools were able to access these storybooks, read it to their fellow students, and also learn from it. So we know that they are being informed when it comes to making the right decision. So that is a huge success for us. What were our lessons learned? Part of it, the support and collaboration we got from the Primary Healthcare Board, agencies, Ministry of Health, and also partners paved way for SWAT team to come to the state and work. And it also brought about owning the project. I saw doing the capacity building training. So you can imagine state actors coming together to voice out the needs of adolescents, and also use it as a means to develop storybooks that reflects their issues, thereby calling on government, calling on partners to see how to come in and help adolescents and youth. That is an ownership spirit. Then secondly, when we had to do with our selection of YDAs, we had to focus on YDAs that were into the space of adolescent and youth development to pave way for sensitization, because if they've been having grassroots communications with adolescents and youth, the process of dissemination will also be easy when it comes to them disseminating the storybooks. Thirdly, one beautiful thing we learned was adapting and re-strategizing. For the fact that you've created a work plan doesn't mean that there won't be a change. So we being able to adapt and also re-strategize on how to also make it effective was a good lesson learned. Now we are moving to challenges. One of our challenges was postponement of the capacity building training. So Kaduna, I will use Kaduna as one of the states we postponed. So Kaduna we were supposed to hold our capacity building early, but because of the high rate of kidnapping and terrorist attack, we had to move it to the last state and stay abreast of situation to ensure safety of the life of our team and also participants. Also, Kano was supposed to be one of our implementing states, but at that time, the states were engaged with other projects. I remember the Data Made Simple project is a one-year project, and every month counted for us, a timeline that we needed to also execute. So we had to change. That was where Kaduna was now replaced in place of Kano. So because of the weather condition too, the rainfall season, we had to also reschedule some of the community sensitization, because if there is rain, most of the community members will not attend. So we had to also be sensitive to the weather. Fourthly, for our dissemination process outside the community sensitization, we're also supposed to hold an advocacy visit to our decision makers. But right now, next year is election, and due to election campaigns, most of our visits and time had to be shifted, because we really need our decision makers to be around for engagement. Although we are still on it, and we are also trying to leverage on platforms that we know that the decision makers will be present. Anywhere we see them, we'll hold our advocacy visits anywhere. So you see our storybooks, we're always holding it. Anywhere we see, we take advantage of it. Now, looking at sustainability, before I state out the sustainability, in as much as the Data Made Simple project is a one-year project, that doesn't mean that if we are closing out today, the project closes. the needs of adolescents. As we're even talking here, one teenager, one adolescent girl is getting pregnant. One is affected as we are talking. So no matter how little you put an effort to meet up with the needs of adolescents and youth, it goes a long way. In your state, what can you do to better the improvement of adolescents and youth in your state? In as much as we are ending this project, we trust you, our state actors, we put it in your hand to see better ways which data can be simplified to reach out to community members and also decision makers. So we are counting on you, and we are believing that the same way our projects have increased visibility in the states too, will get to hear 2023 will be so much results from the state, from primary healthcare board, ministries, and also partners. So we count on you, and we believe that you can deliver on this. So part of our sustainability, SWAG initiative will liaise with the youth data advocates to create a mentorship platform. How do we intend to go about this? You know that 6 communities were reached in the different states when it comes to community sensitization. So the numbers of those people will be moved to our WhatsApp platform. We don't just want them to have improved knowledge. We also want to make sure that their capacity are being built on data use, storytelling, and also different things that have to do with adolescent and youth sexual reproductive health. So there might be a question that will be raised on this mentorship, because we said over 2,000 community members had improved knowledge. Yes, at that moment, we strengthened their capacity and also improved their knowledge. But for us to track progress, it's better these mentorship platforms are held for us to be able to follow up, and that alone can also help by improving their behaviors towards adolescent sexual and reproductive health. Secondly, please can you mute your device? Please, if you are following, send an emoji, because this is a youth program. We have to be youth. Please, can you help me mute? Oh. So are we all following? So we move to the next sustainability plan. So SWAG initiative with partnership with relevant stakeholders, we intend to also produce audio visuals of the storybooks that we've developed and produced, not just for the 7 states. So we're looking at from 2021, the 5 states that we produced and developed storybooks, to 2022. And why do we intend to go this way? We're also looking at all adolescents and youth have different needs. So if we're meeting up with a larger audience, people living with disability, people in IDP camp, people, no matter where they are, as far as they are in Nigeria here, they are being able to hear, being able to read, being able to listen to the storybooks and also learn through the key messages. It will go a long way for us. So we're calling up on partners to also see a way to collaborate with us in order for us to reach larger audience. Also, SWAG initiative will be working with the state actors based on existing relationship to simplify generated data. So I want to ask, in your state, when data are generated, do you just file them? This is an avenue for your state to be heard. I told you that earlier when we were talking about the issues of adolescent health, in as much as we had so much issues, were there a lot of data to meet up with those, to back up those issues? No. So it will also help as M&E officers are going to grassroots communities to generate data. You can, I'll give an instance. If teenage pregnancy from the data you generated in that community is high, don't just file it. There's a need to do an outreach in that community, simplifying data and storytelling. People are moved by stories. So if you gather community members and give like a story, why BC should not be pregnant, why the risk factor of BC being pregnant, she will drop out from school, she's at risk at maternal death, and all of this, you sensitize them based on the results, the data you got from that state. And also, it's also a means to advocate for change. Our directors are here. If they see that there's a need for it to be changed, when they go to different meetings and platforms, they raise it there because they have data evidence proving that this has to be changed in their state. And that's how people will also meet the needs of adolescents and youth. Then third, I think fourthly, the commitment received from the leadership of the State Primary Healthcare Board and State Ministry of Health will enable priority of adolescents' sexual and reproductive health needs when developing policies and strategic documents for project sustainability. So we count on our directors, we count on our ES, we count on our primary permanent secretaries. We know that with you holding adolescents and youth as top priority, it will also reflect in our policies, implementation and domestication. Thank you. So I'll move to the next step. Next step. We're making progress. So now what we intend to do after the closeout is one, follow up with commitment from decision makers to ensure actionable plans are operationalized. So it's one thing to commit and it's another thing, no matter how little it is, your little effort can actually make a big change. So please, don't just commit. Our adult youth data advocates will go to see if there are progress, if steps have been taken to cause a change. Also, for the community members that we sensitized, we are going to conduct a survey to the communities reached just to track progress of their improved knowledge. So we want to also share those questionnaires, the same questions that were asked, to see if they have another understanding, to track progress in it. Then also, we are uploading all storybooks on Swag website for easy access to everyone. It's an advice. This is the season of celebration. This is the season of jubilation. Why don't you also share the storybooks to adolescents and youth? You don't know who you are saving. For us, celebration is all about Christmas, but for an adolescent, it's more like, let's celebrate. You don't know how to go about it. And in the process, they can make mistakes. So you giving a storybook out to an adolescent is, to me, a good gift because the person will be informed in the process. Then lastly, continuous engagement with government and development partners to ensure simplification of real-time adolescent and youth sexual and reproductive health. So now, in conclusion, I'm so excited. I don't know about you. Today, we are here for the national dissemination and launch of these storybooks. We know that with this innovation, decision makers at the national level will pay more attention to adolescent and youth sexual and reproductive health data, and also for interested organizations to adopt projects, best practices in order to promote young people's access to adolescent and youth sexual and reproductive health information and services. Thank you for listening. So, yes. So we'll be playing a video. So just relax and watch.
The reproductive health coordinator for According. I want to say thank you to SWAT Initiative, who came into According in the month of June 2022 to do a workshop tag data next info, simplifying adolescent youth sexual reproductive health data to save lives. After the workshop, we came up with what I have here in hand, the According story. This According story will help us to take decisions, make positive decisions concerning our adolescent youth. According. I stand with Adele. Thank you, Swami. I stand with Adele.
The project has a very good impact in the state, in some of the communities near the sensitization. Various questions, the tasks, surprise the hearing for the various tasks. The different facilities provide contraceptive method to using the well, we need for example, that working with some of these facilities, looking for help. In the helpful information we pass to the adolescents, parents were sensitized, they now know better in those communities, versus traditions.
I hope to see more testimonies of what your project has done in the state. Long live Swat City, long live Accra State Youth, long live the Tamil State Project.
During our visit to one of the secondary school, that really made an impact because even after the visit, after that awareness visit, the principal of the school invited me to the school to create awareness to some of the students, which I did. And this storybook that was given today has been officially used in school, and the advice all the students have been able to lay their hands on this book to read, go through it, and pass it on to their other colleagues, and as well as which stand to take action to take their mentality towards adolescents knowledge. So, in fact, we appreciate the SWAP initiative for the wonderful initiative. Because along with helping most especially my lectures and my adolescents, young. Okay.
As a key I'm an assistant M&D officer, that's monitoring and evaluation officer with the FCT Primary Healthcare Board. I am part of the team for from
much. If you want to see more, visit us on our website. We're going to share more with you. Thank you so much, everyone, for staying tuned to this meeting. I know that there's a lot you've heard today, and we're right now going to the moment we've all been waiting for, the national launch of our storybooks. Okay. Okay, so information reaching me now is that some participants were unable to hear the sound from the video. We can reshare this video, and like I said, that if you want to hear more success stories on how this project has impacted a wide range of people, you can see that from the different videos. You could see a teacher, you can see a student, you can see even the data experts in the States, and even the adolescent desk officers who are who were, talking about how this project has been able to impact lives, and even going forward, how it will further strengthen the dissemination of information on adolescent and youth sexual reproductive health, so that the work can be very easy. So if you did not hear, we would be happy to share the video with you, and we could also play it at the end of this dissemination. So right now, we want to go into the launch. Of course, for people at the state level, this is their baby. So it's not going to be new for them, but yes, we're officially and nationally launching this storybooks, because we know that it is one significant progress that has been made as it relates to adolescent development in Nigeria. And we are going to launch it now, and you will see the storybooks. So as much as we want to send out this information, it's also interesting to see that we've been able to do beautiful things. So I'm going to call on my colleagues, and then we'll do the unveiling. For people at the States, you already know it. It's your baby, it's your storybooks. But yes, we're going to show the world that we have this, and we're going to show you. So everybody, are you ready? DJ, can you play some music before we do the launching? Okay. While the DJ is setting up, we're also preparing to, unveil it and just launch it nationally. So, and let me also use this medium to say that for the Nigerian National Family Planning, which started with the pre-conference yesterday, you can visit us on our booth at the conference. The opening ceremony will be tomorrow. So visit us on our booth. You can come get a copy of the storybooks, and we also have some other materials that we have from Stand With a Girl initiative. So we would also have our storybooks, the e-copy of the storybooks on our website. So you can also download them and send to adolescents so they can have access to it. So are we ready? DJ, are you going to usher us in so we launch our storybooks, or how do you want us to do it? So please, you can turn on your videos. We want to see your faces, how excited you are about this, especially our state actors. Okay, so everybody, can I see you? Can you turn on your videos? Okay. Are we ready? Okay. Can we have everybody? Hola. So we have our storybooks here, and you can see that it is exciting. Catch us at the Nigerian National Family Planning Conference. Check us on our booths, and you will see, you can be the lucky person to get a copy of the storybooks. You never can tell. But this is it. We have for all the states, 7 additional states. And also to inform you that we would also have copies from the states we implemented last year. So we have all the storybooks, and we'll be happy to see you and to have you come, grab and get a copy. Thank you so much. Our state actors, can I see you? Yes, I can see the adolescent focal person from Bauchi State. Malam Umar, yes, I can see you. As many people that we can see here, I would like to, see everybody actually. Can I see you all? Some people's videos are not turned on. Okay, come on. Hey. to have fun. You can see all the swag that we brought to your table this morning, or it's already afternoon, it's past 12. So thank you so much, everyone. But before we go to the end of the meeting today, we know that the program coordinator and officer had said a lot of things, and you have questions that you would like to ask the organization, how we're able to implement projects, and not just the organization. We also have the youth data advocates who were our foot soldiers in the different states who implemented this project and were able to sensitize the communities, the various communities. So we'd like to hear from you. If you have questions, kindly drop them on the chat box. You can request to speak. Would like to hear from you. What do you think about this storybook? And then would also like to hear from you. So if we were to implement it in other states in Nigeria next year, what do you think we can do better? How do you think you can support us even going forward so that this project can reach even to that adolescent in that community where their voices are not heard, so that together we can ensure that every adolescent is able to fulfill their potentials, but particularly their adolescent and health needs. I mean, their sexual and reproductive health needs are met. So the floor is open now. You can, if you want to speak, you can request. I can see the adolescent desk officer of Oyo State, Mr. Demola. I can see Ahmed Young, one of the youth data advocates. I can see Benjamin Yaga, the youth data advocate from FCT. And I can see a lot of, people we worked with in the state who would also be here to answer your questions. So let's hear from you. What do you think? Okay, yes. There's a question here. And the question says, how can we get access? Okay, yes. Thank you, Mary. Mary's iPhone. Mary said, how can we get access to the storybooks, and can it be printed out at our various locations of the intervention to distribute to the adolescents there? Yes, Mary, your comment is noted. Like we said, we have it on our website, but as you want to either produce more copies of the storybooks, we can talk about that later. But for now, we have the soft copies of the storybooks. Yes, it can be printed out, but you would have to, liaise better on how the logistics is going to be, who would be printing it, and how this is going to happen. But before that is done, we have, the e-copy of our storybooks. Okay, Ahmed Young, thank you. Ahmed Young is asking how we can get more of the hard copies of the books for more sensitization. So something is coming to my mind right now. I wish Ahmed Young can just meet with Mary, because Mary is willing to produce storybooks and Ahmed Young is willing to accept the storybooks that have been, produced. So yes, Ahmed Young, there will be room for that. And as a YD, I know that we can take it up from there. Sure, we would be printing more books based on, for sustainability and based on the support that we receive from the different partners that we work with in the different states. So can we have, what do you think about the storybooks? Anybody wants to go? We want to hear from you. We are really interested to know. Anybody wants to say anything? Okay, so reports reaching me now is that we need more copies of the storybooks. Yes, you would get more copies of the storybooks. But while we wait for that, we can go online, go on our website, www.standwithagirl.org, to check our e-copy of the storybooks from even last year and even that of this year. So I can see Blessed. I can see one of the YDAs from Oyo. I can see Aisha, one of the YDAs from FCT. And do we have questions? Okay. I'm waiting now. Okay. Okay, so okay, yeah, Mary, we saw your question and it will be attended to. Yeah, we would share it on our link, but while we do that, we can drop our website. It is on that website that you find the link to the project so that you're able to download the storybooks. Okay, so I would like to call out names now since nobody wants to talk. I can see people already in the meeting. So I saw somebody just now. Okay, Mr. Olaitan Oyedun from Ahead in Ilefe. Would you like to say something about the storybook? Do you think that this is a powerful advocacy tool? Do you think that going forward in Nigeria, we can, reach out to other states that have not been reached? Do you think that if we're to implement this project in other states in Nigeria, how well do you think we can implement this project? Because for us, it's important that we partner with every stakeholder. And when we mean every stakeholder, we mean every stakeholder so that we can achieve our success. Okay, I hope you heard me. Who else do we have? Okay, so I'd like to call Mr. Oh yes, he's up already. Mr. Olaitan Oyedun from Ahead. Yes. Let me unmute you so that we want to hear from you. I think he's already talking.
Yeah, hello, hi. Yes, you can hear me.
Yes, we all can hear you.
That's great. Let me start by congratulating the SWAG team for the excellent execution of the Data Made Simple project. It's good to see you, and it's also good to see the fantastic work that you guys have done in this, particularly across the project states. It's good to see that effort is being put towards ensuring that data gets to where it needs to get to. And when we talk about, not just about pushing out data, but ensuring that young people are able to access this data in a way that they're able to relate with. And for me, I think one of the impressive parts is at the storybooks that have just been launched. Again, congratulations on developing storybooks in diverse languages. I mean, Nigeria is a pluricultural environment, and so it's always important to to design messaging, particularly health messaging, in a way that people can relate with, particularly young people. So I'm happy. For me personally, I think it's a major win that this was done in local languages, and that this access is being made to young people, particularly within the states where they live, where they work, and where they practice their trade. But let me just mention that going forward, my wish for SWAG is that this becomes bigger. We take this everywhere. This is a very important project, and it'll be very good to ensure that this gets to the nooks and crannies everywhere. I mean, ASRH issues, sexual and reproductive health and rights issues are issues that need to be addressed globally and particularly across the Nigerian space. And looking at the success SWAG has achieved in the project states, I think this will be an opportunity for funders to come up and provide a lot more support actually, to ensure that you're able to reach everyone, everywhere and everyone with this kind of fantastic and wonderful message. Again, congratulations to the SWAG team. Have a lovely day. Good, and yes, this is also a goodwill message from the Academy for Health Development in Ilek. Thank you very much. Bye.
Thank you so much, Dr. Olaitan Oyedun. Thank you for those comments and for also calling out for the support, particularly even as we reach other states and make sure that every part of Nigeria they have access to information on their sexual and reproductive health. So thank you so much for that. Do we have any other person who wants to, say something, or anyone If you have any questions, you can just ask us. We want to hear from you. If you need clarification on some things while the project coordinator was, emphasizing on what went into the project outcomes, and you would like to ask specifically on some areas that you need more clarifications on. If you do not have, I would like to call on the M&E officer from FCT. We'll take that, and then we'd also like to hear from one adolescent desk officer. Okay, so let me go to, I'm trying to find, okay, Mr. Ademola from Oyo, the adolescent desk officer from Oyo. I can see you already. If you have something to say, or you want to, just if you have something to tell the participants, so we want to hear from you, or one of the YDA is interested to talk about what has been the major take home for you, even for this project. What is that one thing that, this project has made you become? Any YDA? Before I call the YDA, anybody wants to say something? Okay, Blessed. All right. We can hear you, Blessed. Oh, wow. Blessed. Oh, no. Hello, Blessed. Hello, can you hear us? Oh. Okay.
We can't hear you. Can hear.
Yes, we can hear Blessed. So
Can we just take Umar Abubakar?
yes,
What?
let's take Umar. Oh yes, she's okay. So can we take Umar from Bauchi State? Is the adolescent focal person from Bauchi State? Malam Umar, can you hear us? Okay, if I saw him in the, oh yes, he's here. Can you hear us, sir? Can you hear us? I think you can speak now. Okay, so hello. Okay, so let's hear from the other adolescent desk officer that we have. I think Malam Umar has a bit of issues with his network. Mr. Ademola, let's hear from you. Hello. Okay, so Emediong, while we wait for the others to speak, can you go? Let's have you. Emediong, can you hear us? Is one of the youth data advocates from Akwa Ibom State. Can you hear us? Oh yes, you can speak now. We can all hear you.
Can you hear me?
Yes, we can.
Okay. Good afternoon, everyone. My name is Emediong Akpaso. I'm one of the YDS from Akwa Ibom State. The Data Made Simple project has really helped young people in Akwa Ibom State, because from the experience that I've had during the sensitization outing that we have gone, and also with the advocacy and courtesy visit that we have paid to many actors within the states, their responses has been quite motivating, because they have, like for the state actors, they have agreed to support programs concerning young people, and also to ensure that access to information on reproductive health reach remote areas that most information have not gone to. And for example, the Ministry of Health, where focal persons for adolescents and young people are always being posted, maybe the ones that are being trained by partners are always being posted out of their place of work to maybe new places that maybe youth-friendly centers are not there. So they have agreed that much transfers that do transfer young adolescent and young people, focal persons, away from their place of assignments to places that maybe youth-friendly centers are not functioning. They have agreed that they will put an end to that. And for young people have really appreciated the storybooks, because they find it quite educative. And what you have asked before, and I've been given information on that more books will be produced for desensitization, because we really need more of those books, so that we can go out to places that really need the book also, mostly the riverine areas that these issues are really happening. Because what we got to know during this sensitization is that those riverine areas, they are the most affected areas that really needs information concerning sexual and reproductive health. Because we got to know that young people like be less than 12 that are being impregnated and also being exposed to sexually transmitted infections and disease. So if we get more copies of the books, it really help us to reach out to the unreached in Akwa Ibom State. Thank you very much.
Okay, thank you so much, Emediong, one of the youth data advocates from Akwa Ibom. Okay, Mr. Umar, I don't know if you can still speak. So we have you before we call on one representative of the M&E from any of the states who are present in the meeting. Can we hear you? Okay, while we wait for that, I see a lot of partners who have joined us. I can see a representative from Pathfinder International Nigeria. I can see other partners who have joined us. Would like to hear from you. What are your commitments going forward? We've presented the project outcomes to you, and to ensure sustainability, we know how it is important that we partner with we partner with stakeholders in the different states. So would like to hear from you going forward. How can we, ensure that we reach more adolescents and we're able to bring that change that we want to see, especially as it relates to sexual and reproductive health for adolescents in Nigeria? So I would like to call on Kosi while we wait for one of the adolescent desk officer. And then other organizations who are here would like to hear from you. What are your commitments to, you ensuring that as much as, yes, SWAG implemented this project, but we know that it's for the development of every adolescent in Nigeria, and we know how partnership is important. So would like to hear from you. I see her. I don't know if she's still up on this call. She's still there? Yes. Okay, let's hear from you, Shoaibu, Wakili. While we wait for Hello, Wakili, can you hear us? Hello? Okay, oh. Okay. Okay. All right, Kosi, thank you so much. You can just drop it on the chat box if you can't speak right now. But
If you say that I can't, okay.
oh yes,
Hi,
oh
good
wow.
afternoon. All right, so I was trying to
I
unmute
just
myself.
understood what you said now. Thank you. All right.
Yeah. All right. So good afternoon, everyone, and well done to the SWAT team. This is very laudable, and I'm very, very happy and proud to at least be part of this process. I know that I've been following through on your work, through all of your webinars and disseminations. And I must say that this is really a good step in the right direction, knowing that for us who have been in the adolescent space for a while, we've had challenges with data, especially as it relates to adolescent programming. And definitely Pathfinder as an organization that works in the area of reproductive health of women, adolescents, and young people, we will definitely be partnering with you moving forward, especially in the states where we are present, to see that these data are used and strategically placed for programming for adolescents. So congratulations to you guys and well done.
Okay, thank you so much, Kosi. That's noted, and thank you for your kind words as well. Thank you. Okay, over to you, Malam Umar is the adolescent focal person for Bauchi State, one of the states we implemented the project. We can hear you, Malam Umar. Yes, we can hear you.
Afternoon all. Can you hear me all?
Yes, we can hear you, sir. If you can turn on your video and it's not going to affect your network, it will be fine to have you to see your face. And then
Okay, no problem.
Okay, yes, we can see you.
Yeah, okay. Here in Bauchi, really, we really appreciate the storybook, not necessarily that the community that we have been distributed that storybooks. Apart from that, after we distributing the storybooks, some of the members of the community used to call us and even ask us, when are we going to go back to them for the more awareness and give them more storybooks? And still, there is many community that we plan to go for that due to some reasons, maybe for the transportation for that advocacy during that one, we didn't able to do, we changed the community. So that community, they really need us to go to them for that advocacy and storybook dissemination. So I feel this Stand with the Girl initiative. We really appreciate the effort and the things done to us in Bauchi. And even now, some of the local government in Bauchi really need these storybooks, and they need this awareness. Especially now, we are on another project that we do now, like youth clubs, that with the collaboration with UNICEF organize this one, and we are on it. When we went there, we taught them about this storybook. They really appreciate it and say that they need that storybook. Even some of my data advocacy and other MIAs, we work together with them. Now we are planning to, even without this meeting, we are planning to give you some advice. Maybe when are you coming back to Bauchi for this sensitization again? Thank you very much. I really appreciate it.
All right. See you soon in Bauchi. Maybe I should add that.
Yeah. Okay.
And yes, when are we coming back to Bauchi? Yeah, we would come back. Yeah, when we get the support, like you said, that as much as we want to reach a larger audience and even reach more adolescents, we all know how this is cost effective. And we know how that even implementing these projects would come up with a lot of, getting this adolescents and even printing more, such as even the cost of printing more storybooks. But I know that with the partners that we have working in Nigeria, we would be able to, implement the projects in more communities in the states we've been before and subsequently more states in Nigeria. So thank you so much. Yes, and also to add that you rightly mentioned that you mentioned a club where UNICEF, an adolescent club where UNICEF is, partnering with the Bauchi state government to implement programs for adolescents. This is an avenue where even the storybooks idea can be pitched to them, and we ensure that we reach more, adolescents in the state. And I would also like to call on other people from the other state actors that we should ensure that in partnering, we as much as we want to reach adolescents in the grassroots, we should make sure that when partners come to the states, we make them know that this innovation has worked. And by the time they support us, it's going to reach more adolescents, and also make sure that development, is taking place in the different communities in the states and even largely in Nigeria. So thank you so much, Malam Umar. I would like to hear from one YDA, even though the moderator, our beautiful moderator, is one of the YDAs, but I would like to hear from one of them. I don't know if Blessed is back, but if not, we can take another person. I think she has a bit of network issues, so that we can close this meeting. I know that everybody has a lot to go for and all that. So we have our M&E. So I can see one M&E officer from Oyo State. Yeah, we would have taken that from FCT, but I think he has a bit of network issues. So let's hear from one M&E officer, and then we go YDA, and then we hear from one partner, and then we'll come to the end of the meeting. So over to you, Ma, Mrs. Adebola from Oyo State. Okay. So Mrs. Adebola, I think you can speak. I've asked you to, unmute yourself. You can do that if you can hear us. Okay, there is Comfort Thompson. Can you hear us? You are speaking, but we can hardly hear you. Okay. Comfort, can you hear us? Thank you so much, Fanny, for your message on the chat box. We can see that, okay, she said Data Made Simple gave me a new dimension to data translation for me as a programs person. That's amazing. The storybook is, okay, where is it? The storybook is a tool that serves different purposes. Okay, the storybook is a tool that serves different purposes. And I'm trying to get a message very well. Okay. Ethel, can I have that so I read out what she has said? Okay. Thank you so much, Fanny. That the storybook is a tool that serves different purposes depending on the person reading it. For the parents and policy makers, it gives a glimpse to what issues young persons are facing and how best to address them, putting face to figures. Interesting. For young people, it is a fun way of discussing sensitive issues. The stories are so relatable that every young girl can find someone of their status in the story and make decisions. Thank you so much, Fanny, for your support throughout the project implementation and even down to where we are right now. And we know that going forward, you would also ensure that you partner with us to reach out to other adolescents in your states and even as it relates to every other parts in Nigeria. So, Mrs. Adebola, can you hear us? Or one of the YDAs who is ready, anyone who is ready can just take up. We want to hear from you, and we want even participants attending this meeting to hear from you. Okay. All right. You can keep dropping in. I know that some people might have issues with internet connection, but you can just feel free to drop your messages on the chat box, and I'm very sure that everyone is seeing that and everyone is taking note of it. So do we still have anybody from the meeting who wants to say something or make a commitment concerning the storybooks before we come to the end of the this meeting, so that we don't keep everyone waiting? We appreciate you joining us. Okay, is somebody speaking? All right. All right, so let me hand it over to the moderator. I know that we still have more. You can reach us, you can connect with us on our website, you can connect with us via email if you still want to, ask more questions about the project and how you can even collaborate with us at Stand With A Girl Initiative to ensure that we reach everybody, we reach the different groups of young people, and ensure that sexual and reproductive health for adolescents in Nigeria is given that utmost priority, especially in decision-making process. So thank you so much, everyone. I'll hand over to our beautiful moderator, one of the YD. I'm sure she has something to say as well. Thank you.
Thank you so much. Thank you so much, Mercy. I hope that we've been enjoying ourselves and having a good time in today's dissemination and launch of our storybook. I can see Adamu Yusuf's hand up. If you have a comment, I can unmute you. But very briefly, just for 30 seconds, let's hear your question or suggestion. Thank you very much. Over to you, Adamu Yusuf. I've asked you to unmute, so you can unmute yourself. We can have you. Thank you.
Hello, can you hear me?
Loud and clear, thank you.
My name is Adam Yusuf Ushishi, a YTA from Kaduna State. My contribution here is a contribution and is a bit of a question. Can you hear me? Hello?
Yes, we can hear you. Please go ahead with your question.
In Kaduna State, we have 23 LGAs. And we have so many communities in Kaduna State per se. Where we work, where we do our sensitization is only in 5 LGAs. So, and after the sensitization, so many LGAs were not covered. And that's why we select only metropolitan LGAs. All the other LGAs wanted to benefit too from the program. So I don't know if there's a way, or maybe I don't know if you're coming back so that to increase the number of LGs, maybe you can expand to other LGs that did not benefit from the recent program, so that they too can benefit. Even if we can't cover all the LGs, but at least we can also select like 1 or 2 LGs, maybe make it like 5 LGs. That's the way we did this one. That's my question. Thank you.
Thank you very much. Ethel answered the question.
Thank you, Mr. Adamu, for that question. Can you hear me? So the reason why we had the 3 days capacity building training was to strengthen your capacity. And we were not just looking at those people present, we're also looking at you, counting on you, those people present, to also step down the training to other colleagues. So if it's a local government M&E, we know we can't reach out to all, because looking at different states and their local government M&E is many. But 5 can reach out to 10, 10 can reach out to 10. So if there's a way you can hold a meeting to strengthen their capacity with the adolescent desk officers there, the YDAs there, all of these can form a strengthened network system that will help step down the training. And if you also need us to participate online, we can also come in and support. But the reason why we wanted to strengthen the capacity of 5 in each state is because we count on those 5 people to step down the training to other colleagues. Thank you.
Thank you very much, Mr. Damu. I hope your question has been answered. On the chat box, I can see Comfort Thompson's message, and she's saying that in Akwa Ibom, they are blessed to have been associated with this DMS project, and that they hope that they do more work with adolescents in the state. And that is because we keep talking about sustainability. This project is not supposed to end here. We all, as stakeholders, as youth data advocates, as adolescent desk officers, members of the government in the primary healthcare boards and ministries across board, we all have our own responsibilities to play, and it's important that we continue the good work so that we're sure that at the end, every young person, every adolescent have quality access to the right information as regarding their sexual and reproductive health in Nigeria. Thank you so much. It's been interesting. It's been an exciting launch. It's been an exciting meeting. And even as we wrap up now, we want once again for everyone to, if you can, put on your video, put on your camera. We want to take a group photograph. If you've got the storybook with you, please show your storybook. We would like to have a group photograph with everyone. I've not seen, okay, yes, some people have started turning on their cameras. Please put on your camera. We want to see your beautiful and handsome faces. And this, for record purposes, it's a national launch. We want to be able to look back and remember today and say, oh, yes, Umari was there. IJ, I saw Esfani, I saw the wonderful people from our Med project program. So please, let's turn on your video. Let's turn on our video. I see you, Daniel. I see you, Precious. I see you, Renee. If there's anyone with the book, please, let's bring it out. Who's going to take the picture?
She's doing a screenshot. So
oh, okay, fantastic. I see you, Martha. Innocent. We're waiting for you. We just have 30 more seconds to do this. Please, let's put it on
I'm not seeing
camera.
Wakilio.
Mrs. Adebola, Adebola Agbola, Benjamin Yaga.
Ben.
YDAFCT. Enna Zagi, please, let's see you. Okay. All right. Smile for the camera now. Let's see your lovely 32. 32. Is it? Are we taking the screenshots?
Yeah.
Thank you so much. Yeah, you see, I like that, Irene. Young people swag.
Yeah.
Oh, we see you, Edie.
Thank you.
Thank you so much, everyone. We have promised.
What else? I can see you.
Bauchi State.
From Bauchi, yeah.
Yes. Thank you. Well, it's such an honor to have everyone. Thank you so much for actively participating in this meeting. We've promised that if you filled the attendance sheet, your emails are there. You have access to the soft copies of the storybooks. If you go to the website, which is www.standwithagirl.org, you would have access to downloading the soft copies of all the storybooks, those published this year and that of last year. And also this presentation would be shared because it's been recorded. It will be shared with each and every one of us via our email addresses. Please, let's continue the party on your WhatsApp status, on Facebook, on Instagram. Send the recording to your friends. Let people know that the Data Made Simple project is something that we all should partake in. Thank you once, thank you twice, thank you a million times. Once again, I'm your host and moderator, Chinenye KOB, AYDA, here in FCT. It was lovely to have you. Have a wonderful day and enjoy the rest of your day. Thank you so much. Bye, guys. You can say bye. You can unmute yourself, unmute your mic and say bye to everyone if you can. Bye. Thank you so much for joining us.
Thank you so much.
Thank you. Hi, Margaret. Bye.
Say bye.